How is the coronavirus tests and why is it important? The number of coronavirus cases continues to increase in the world, and where it has affected more than 2.5 million people in more than 200 countries, the death toll has increased to more than 100,000. Governments around the world have reacted in various ways to the fight against the coronavirus, and one of the things that the World Health Organization has called the most important in this endeavor is the diagnosis of the disease. Is the process of testing. Testing for the coronavirus in the world continues at different speeds in different countries. In the United States, where the process was initially shown to be slow, it has now become the most affected country in the world, and now the testing process has accelerated there. There, countries like South Korea and Germany began aggressive testing right from the start of the outbreak, resulting in fewer deaths. Speaking of Pakistan, there were very few tests in the beginning, and by April 15, the test rate was around 360 in a million people nationwide. The question is, what tests are available to diagnose the coronavirus in the world and how widely they are being used in different countries? How many types of coronavirus tests are there? There are two types of tests being performed in most hospitals around the world where coronary disease is being diagnosed. One is swab test and the other is antibodies test. The swab test is performed by sampling the suspect's nose or throat, which is then analyzed in the laboratory to identify the virus's genetic material. The second type of test is the antibody test. This test can see if a person has already got the virus. In this type of test, the immune system is seen using blood drops on a device. It's just like a pregnancy test. The British government has purchased 3.5 million antibody test kits, but none of them have yet been found to be reliable for mass use. To what extent do these tests produce accurate results? Swab tests used in hospitals are reliable, but this does not mean that it is possible to identify every coronary virus patient during these tests. If a patient is at the very beginning of his infection or if his body has a very small number of viruses, such a person's test may also be negative. If the virus cannot be picked up sufficiently for the swab test to be taken from the throat, then the swab test may be negative. So far, antibody tests have not been so reliable. UK Health Secretary Matt Hancock said 15 of the best antibody tests were tested, but none of them were good. Professor John Newton, who oversees the tests in the UK, told the Times newspaper that test kits purchased from China were successful in detecting antibodies in patients who were critically ill with the coronavirus, but not in patients whose condition was worse. They failed. Why is coronavirus tests important? There are two important reasons for testing people. First, to diagnose them individually, and secondly, to determine the extent to which the virus has spread. This information can help the Department of Health and medical staff plan ahead, including how many units of intensive care will be needed. Testing can also be helpful in decisions about measures such as social distance. For example, if a large number of people have already been infected, there is no special need for lockdown. And the lack of more extensive testing means that many people, including health workers, can isolate themselves without cause. How widely are different countries doing the testing? In the world, the United States is currently the most affected country with corona, where up to 32 million people have been tested for corona, out of which more than 6 million people have been diagnosed with the virus and more than 30,000 have been killed. In addition to the United States, more than 1 million people have been tested, including Germany 17 million, Russia 1.5 million, and Italy, the most affected country in Europe, 11 million. Talking about Pakistan, about 80,000 people have been tested in the country till April 15. Currently more than 5,000 tests are being done daily in the country, and according to the Prime Minister's advisor for health, the government plans to increase the number of tests to 20 to 25,000 by the end of April.